Hello, I am Dr. Piyush Shah, Senior Orthopedic Surgeon practicing in Ahmedabad city in the satellite area since last 30 years. What is the importance of musculoskeletal health? Musculoskeletal health plays a key role to keep up good mobility in an individual along with enhancing their ability to work and actively participate in all aspects of life. Musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. Physical activity plays an important role in reducing non-communicable diseases. What is the relationship between painful musculoskeletal conditions and a reduced capacity to engage in physical activity? Impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation and withdrawal from usual social, community, and occupational activities, further decreasing the quality of life and well-being, including mental well-being. Impaired musculoskeletal health can lead to substantial personal, community, and social consequences, particularly in older people. Painful musculoskeletal condition leads to lack of physical activity, which results into functional decline, frailty, loss of well-being, and loss of independence, as well as depressive symptoms. Individual with arthritis and musculoskeletal health is definitely lesser active than individual without arthritis. Impaired musculoskeletal health leads to reduced physical activity like grip strength, walking speed, chair raising, and standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component in frailty. What is the impact of impaired musculoskeletal health? Impact of impaired musculoskeletal health is now recognized globally with increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active, productive, and prolonged working life. With an increasing in global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers as many occupations are associated with musculoskeletal disorders like low back pain and shoulder disorders. High income countries observed musculoskeletal conditions to be one of the major causes of work loss, early retirement, and lost retirement wealth. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at all levels. Since musculoskeletal disorders are chronic, painful, associated with disability and social disengagement, frequently causes mental health impairment such as depression and anxiety, as well as other comorbidities. What is the burden of disease related to musculoskeletal conditions? Non-communicable diseases now account for most of the global burden of the disease, with musculoskeletal conditions being the leading factor. Developed countries well recognize the transition of burden to long-term conditions. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal conditions such as osteoporosis and low back pain driven by population growth and aging. Since age is the most common risk factor for musculoskeletal condition, it is estimated that by 2050 there will be 5 times as many people over 40 years living in developing countries compared to rich countries. Obesity is also important risk factor for many musculoskeletal conditions and is expected to increase dramatically in coming 2 decades. Increased use of motor vehicles, reduce the physical activity, and increased number of motor accidents results in musculoskeletal trauma and disorders. What is the role of physical inactivity and sedentary behavior in musculoskeletal health? Sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, binge watching seem to be the prime contributor. This surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized a substantial global economic burden. Increasing physical activity and optimizing exercise as recommended by Arthritis Research UK versus Arthritis and WHO is an important way to improve musculoskeletal health. A recent meta-analysis utilizing the data in more than 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the increased risk of death associated with 8 hours of sitting. Moderate level of exercise, physical activity remains the key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior can lead to obesity and type 2 diabetes. Obesity is also a major contributor to the development and progression of osteoarthritis. Evidence suggests that increasing the level of physical activity not only increase musculoskeletal health but also decrease the risk of suffering from obesity related diseases such as diabetes and osteoarthritis. What is the WHO recommendation on physical activity for healthy individuals? About 2 hours per week of moderate physical activity or about 20 minutes per day of any kind of physical activity like brisk walking is recommended by WHO. These exercises elevate the heart rate and associated with a lower risk of cardiovascular disease lifelong. It improves the cardiorespiratory fitness also. Now, what is the focus on evidence-based interventions for the musculoskeletal conditions that cause the most deaths, means disability adjusted life years? Low back pain and neck pain can be benefited by regular exercises. Routine exercise and dancing and gardening activity, participation in fall prevention program will reduce the fall and increase the strength of body. Osteoarthritis has been shown to be benefited from exercise that improves muscles, aerobic fitness like walking, swimming, and pilates. Weight loss support can be rendered if required. Explain the association between the healthy aging and physical exercise. Aging is inescapable but can be made easy and healthy with the help of exercise. A recent systemic review concluded that physical exercise causes positive impact on muscle mass and function in healthy subjects aged 60 and above by improving muscle performance by increasing the ratio of type 1 and 2 type 2 muscle fibers and increasing the cross-sectional area of type 2 muscle fibers. A European Society for Clinical and Economic Aspects of Osteoporosis, Osteoarthritis, and Musculoskeletal Disease Task Force recommended higher protein intake in combination with physical exercise in postmenopausal women at the risk of developing osteoporosis. Fragility fracture risk associated with osteoporosis can be decreased by exercise program as exercise increases the bone marrow density and reduce the inflammatory markers. Furthermore, exercise and mechanical loading also have a positive impact at the molecular, cellular, and tissue levels. Exercise or loading can induce an increase in tendon collagen synthesis, thus increases the tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining the cartilage and bone health. What is the relationship between obesity and musculoskeletal disease? Surge in sedentary behavior and unhealthy diets have caused global obesity epidemic with sharp rise in type 2 diabetes. These are further risk factors for cardiovascular and neurodegenerative diseases, which ultimately lead to poor musculoskeletal health. Obesity is closely related to the development of osteoarthritis, which is the commonest musculoskeletal health disease. Exercise and weight loss have benefited overweight adults with osteoarthritis knee in many clinical trials. Thus, combining weight loss and moderate exercise provide the best improvement in pain and joint function. What are the consequences of childhood obesity and physical inactivity? Lack of exercise in childhood leads to childhood obesity, which further leads to musculoskeletal pain in later life. Consumption of unhealthy diet and sedentary lifestyle leads to childhood obesity. Foods low in nutritional value and high in caloric content contributes to the obesity epidemic, which may play a role in high prevalence of type 2 diabetes and cardiovascular diseases, which further leads to lack of fitness. Is diet also a part of healthy living? How does it affect musculoskeletal health? Yes, diet is an inevitable and important part of healthy living. 3 years follow-up study in 400 adults showed that diets high in potassium, which is derived from fruits and vegetables, helps in reducing the muscle loss in adults above the 65 years of age. Dietary flavonoids intake from fruits and vegetables is also positively correlated with good bone health in form of bone marrow density and reduced bone resorption in perimenopausal women. Vitamin D, calcium, and protein consumption have been shown to optimize muscle bone functional outcome in older people, thus reducing the fall and fractures. Calcium and protein synergistically optimize the bone health. Thus, dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D, and vitamin K, which helps in bone and cartilage mineralization and decreasing the blood cholesterol also. Antioxidants-rich diet may benefit to the athletes by improving their tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with a dietary supplement of whey protein fortified with vitamin D as it increases muscle mass and strength. Thank you.